Okay, let's talk about the thread. I will deal with the thread with this presentation. My presentation can be summarized into three words. The first, PLACL, the new material. The second, Cog Master Gear, one of the most important products from AquLift. The third, Extender Master, new product, which will be really useful. So actually nowadays, the PDO, polydioxanone, is widely used for lifting thread. This is biosoluble materials. But the duration of PDO is just 6 months. Yes, 6 months. But it means it takes 6 months to be disappeared completely. As a thread, it easily can be fragmented in a month. So that's why our patients complain in a month after the procedures. The thread starts to be fragmented. Finally, it became a material, not a thread anymore. It doesn't have any physical pulling as a thread in a month. That's the reality. Even though we are developing many complicated applications of thread, it only goes for 1 month. After that, as a stimulant, which can produce collagen around the tissue, of course it works, but it's not so effective as we expected. That's why we should look for second materials for lifting thread. The PLACL can be one of the most competitive materials for this. PLACL is the compounder of PLA and PCl. We know these materials. We know PLA, we know PCl. PLA is too hard if we make it as a thread. PCl, by the way, is too soft. But the hardness of PLACL, the compounder of these two materials, is quite ideal for lifting thread. It's like this. PCl, too soft. PDO, ideal. PLACL, slightly harder than PDO. PLA, too hard. So these two materials, PDO and PLACL, in terms of hardness, is very useful for lifting thread. But as I mentioned, the PLACL is slightly harder than PDO. So if you apply 3 threads for the pulling up the tissue around here, if you use PLACL, 1 or 2 threads is enough because it has better anchoring power. This is the PLACL. Several companies already developed these materials for lifting thread. They've also accumulated a lot of studies which can show us the efficacy and the safety of this material. Additionally, today I'd like to share the result from an experimental trial. This company produced PDO and PLACL thread with the same manner. Then they implanted these 2 threads into SD rat model. You know rat, the big mouse, rat. It's not mouse, but it's kind of mouse, rat model. And after necropsy, they compared the result. First, biodegradation. Actually, the duration of PLACL, they say that it goes at least 3 or 4 times longer than PDO. As we expected, the biodegradation of PLACL is much longer than that of PDO. But what is interesting is that at the point when 90% of thread remains, for PDO, it's just 1 month. But for PLACL, it's 4 months. You know, after this moment, the thread starts to be fragmented. Then it's not thread anymore. It doesn't have a physical pulling as a thread. We can prolong this period to performance if we use a PLACL thread instead of a PDO. So we can satisfy our patients more. After the fragmentation, it should stimulate surrounding tissue to synthesize new collagen. They also compared this result in terms of angiogenesis, inflammation, and collagen formation. As we can observe, the blue is PDO, green is PLACL. The score of PLACL is much superior to that of PDO. As a physician, we should be very sensitive to change some materials when you apply it to patient. So for me, it takes 3 years to change my thread from PDO to PLACL. I try to move very, very slowly, conservatively. But finally, I do not use PDO thread anymore. I usually completely use the PLACL thread instead. I know, so even in Japan, Japanese doctors are extremely conservative. They are still very nervous to use PLACL, but nowadays they are using this material commonly. Okay, actually we do not dye the thread, so the color of PLACL is a transparent, or some people call it white. Actually, the PDO is purple or blue, but the PLACL is transparent, or you can call it white. Furthermore, curve master gear. Most of the products from AquLift, they have two versions, PDO version and PLACL version, so you can choose. But maybe the PDO must be a little bit cheaper, but the duration is much shorter, so you can choose. Of course, you can. I heard that most of you are using the products from AquLift. So you may have some experience with using PDO thread from AquLift. Then you can choose. The most important products, the main products of AquLift is curve master gear. It's bidirectional curved thread. Actually, it's a molding curve. It can be also called sculpted curve, molding curve. There's no damage on the shaft, and the curve is protruded, very big and strong. It's loaded on 10 centimeter long blunt cannula, straight blunt cannula. Actually, for this picture, it's L-type cannula. This is curve master gear 1. So you can insert the cannula and advance it through subcutaneous layer, remove the cannula. Then thread will be located under the tissue. Then there is some exposed part. You can pull this part a little bit more. This part will resist, but this part will be easily glide. So the middle portion of the tissue will be contracted and protruded, shortened. If we apply this vertically, it can be the lifting. But we can check the middle part of the tissue will be contracted and protruded, like this picture. We apply the thread on pork belly. The middle part can be contracted and protruded. This is the mechanism of bidirectional curved thread. Furthermore, curve master gear 1 is loaded on L-type cannula. So previously we used the sharp needle, but the tip of the sharp needle can cut vessel, muscle, nerve, gland, duct. It can cause a lot of collateral damages. To reduce this, we loaded the thread on this type of blunt cannula. Curve master gear 1 is loaded on L-type cannula. We also use W-type, and sometimes the most developed type is this one, W-A-type. Maybe the tip of the cannula is still blunt, but slightly sharper than round cannula. So curve master gear 4 is loaded on WA-type cannula, because you must be the KOL in Israel, so you should educate your colleague doctors there. So we should know the difference from Kogumaster gear 1 and gear 4. The bidirectional cogged thread, but Kogumaster gear 1 is loaded on L-type cannula, 4 is on W, A-type cannula. I prefer this one. It's easy to insert with less side effects. Dual, we also use long thread, long bidirectional cogged thread, but both ends of the thread, 10 centimeters long, needle is attached. Dual, we call it dual. It has two sizes, 30 centimeters and 42 centimeters. I usually apply 42 centimeters one. So let's talk about the application. Actually, I'm a plastic surgeon, so for the patient who have drooping on their eyelid, I recommend blepharoplasty first or sub-brow excisional lifting first. But there are also some patient who doesn't want to get the surgery. In that case, we can recommend the thread lifting instead, which is also called foxy eye. Yeah, but in Korea, naturally we have laterally slanted eyelid. So for an elderly person in Korea, we should insert the thread, not only the lateral, but also in medial. But in Middle East, it must be quite different. In your case, I heard that most of people want to correct only on the lateral side. So you can decide where you can make the inserting point. For this picture, I can make 2 inserting points on the level of lateral canthus and the margin of lateral limbus. The limbus means the black part of our eyes. So just below the eyelid, you can make some inserting point. So you can decide where you make the inserting point. I already injected lidocaine solution. I've also infiltrated tumescent solution on the fast way of the thread. You insert the thread and advance it to the hairline first. Then I will use Kogumaster gear 4, which is loaded on W, A cannula. You are following me? Okay. So it's a bidirectional cogged thread, which is loaded on WA cannula. I insert the thread and advance it to the hairline and remove the cannula partially, then reinsert the cannula, and for this time you can advance it to the lateral side, then remove the cannula. You don't have to cut off the useless part. You know, the thread is quite expensive. If you use it completely, it must be much more beneficial. So insert back, insert back. Finally, you will make L-shaped application. So you can choose how many threads you can apply. It depends on the condition of the patient. Furthermore, you can also apply dual type thread here as well. You can also make an inserting point. You can insert one leg of the thread and advance it to the hairline, and it will come out here. You can insert one more thread here, one more legs here, and advance it to the lateral side. Around the hairline, the needle will come out again. Actually, the anchoring capacity of dual needle is better than that of cannula type, but it can also make several side effects because the cutting edge of the thread is quite sharp here. It can be protruded. But with the cannula loaded type, actually the tip of the thread will be folded, so it will not easily extruded out of the skin. Do you understand? Mm-hmm. Yes. Okay, so I only applied the cannula type loaded thread here on the only left side. We can find out the difference. So so for Korean, we should correct not only the lateral but also the medial. We insert the thread here and here, there and there. For the better correction, I can also apply the thread on hairline. The application is the same, this way.
How many
size you mean, the 18 gauge.
Combined with the botulotoxin?
Why not? Yes. It's your decision, why not?
Four together.
Together. Yes. Yeah, I prefer to apply 19 gauge as well. 19 gauge is okay. And you know, Kogmaster gear is a kind of shortening thread, which means shortening. You shorten the skin, contract the skin, insert the thread. The thread will keep the shortened distance. It's a shortening thread. So we have another kinds of thread, which can be also called lengthening thread. You extend the skin, insert the thread will keep the extended distance. It's the opposite thread, lengthening thread. There are two types of thread. It's very usual, but it's really new. So we should check that these cogs for lifting thread, for the shortening thread, aims both lateral side of the thread. On this part, it aims to the lateral end. On that part, it also aims to the lateral part. But for extending type thread, actually the direction of the cog is totally the opposite. These two cogs are aimed to the center of the threads. So this can be called reverse bidirectional cog thread for extension. Actually, we are using this thread for the nasal tip augmentation, but it's made with cutting cog, which has less anchoring power, and it was unidirectional. The dislocation can happen. It can move more. But for this time, new material, Extender Master, is bidirectional molding cog, or it can be called sculpted cog. It's bidirectional. There's no dislocation with this thread, which is loaded on 4 cm sized cannula. It's called Extender Master. Actually, we have both size, 25, 30, 40, 50 millimeters. It means the length of the threads. It's extension type thread. You extend the tissue and the thread remove the cannula, the thread will keep the extended distance. For the correction of nasolabial port and marginal line, we can use this kind of thread. First of all, drooping happens from the anterior molar, from the whole face. There is accumulated drooped tissue here. To correct this, first of all, we can apply pulling up thread here to pull up the accumulated tissue. So we can use conventional bidirectional cogged thread, like cog master gear, 1 ruffle, this way. But additionally, for better correction, there is a pulled accumulated tissue here. I'd like to extend here. So you extend the tissue and insert the extension type thread like the Extender Master. You can release the port. It also happens on marginal line. We can correct the tower first with shortening thread. Then we can also extend the collapsing here with extension type thread. You know, if I insert this long thread, it requires a lot of technique. Sometimes it can make some irregularity or side effects, but it's much shorter. Even for beginner doctors can insert, this short thread without side effect easily. And the length of anchoring for this thread is quite long, so you cannot control the power or capacity with the thread easily. But with this short thread, it's much easier. Yes, this is the application for the correction of a nasolabial port. You can also have the same picture on your handout. Yes. I can make inserting point 1 centimeter apart from the hairline on the level of lateral canthus. I can insert 2 quartermaster gear, 1 or 4 thread, and advance it. The tip of the cannula should be located at least 바깥쪽에 저기 배달이 왔는데 위쪽으로 좀 가라고 얘기 좀 해주세요. The tip of cannula should be located at least 1 centimeter lateral from the deepest part of the nasolabial port. If you advance more, the tip will catch the deepest part and pull up, which can cause aggravation of nasolabial port. You may understand that, right? Yes. We should put the cannula tip on the most protruded part, not the deepest part. Okay? And for better correction, I applied the reinsertion technique. For this time, I can advance the thread to the temporal area. 1, 2.
You take the ligaments or just skin?
I do, yeah, because it's a L-type, you don't have to anchor it on the ligament because it can also cause some irregularities. I will show you how to apply it later because it's a kind of anchoring which is caused by the tissue itself. I will call you later. I know that there's a zygomatic cutaneous retaining ligament. It can create some dimpling. That's why you should. Generally, you should. I will tell you later precisely. It takes too much time. Additionally, you can make a 2 inserting point on the medial side of the nasolabial port and advance it across the port here. I try to make flat the port across the nasolabial port with extension type thread. For this application, I used Flexiform. You don't have this model in Israel, but soon you will have that model. Insert 1 thread and advance it to the 1 centimeter lateral from the nasolabial port. Reinsertion and advance it to the temporal area. I applied 2 threads here. Additionally, with my left hand, extend the skin around here. I insert 2 extender master thread across the port.
Can you repeat please? It's not fast.
Or you can do it in operation by yourself. Okay. Furthermore, it's also the same with the tower and marionette line. We can insert 2 quartermaster gear thread from the anterior part of our ear, advance it 1 centimeter lateral from the line, and re-advance it to the temporal area. For the correction of the marionette line more, we can insert 2 extender master thread across the line. I try to reduce the stepping across the marionette line. Quartermaster gear 4, fix and reinsertion, another thread, fix and reinsertion. After extending the line with my left hand, I can insert 2 extender master threads. I correct the, excuse me, you cannot take a picture for the patient, I'm sorry. I'm sorry to not take a picture for the patient. Okay. So I can correct the nasolabial port for this patient, this. Actually, for her, I've also inserted the extender master for the correction of tear trough as well. You can make an inserting point 2 or 3 meters above the tear trough on the level of lateral limbus. Then you can insert 2 or 3 extender master 30 centimeters. 1 here. So, the extender master has 4 sizes, 25, 30, 40, 50. For this case, I usually apply 25 or 30, the short one. For correction of nasolabial port and marionette line, I usually apply 40. For this, 30 or 25. Additionally, to fill the depression, I can also insert a multi-line thread, short model, multi-line 38 millimeters to fill the tear trough and nasal groove. This is a multi-line thread. If you insert one cannula, you can apply 14 threads at the same time. So it can be also used for the correction of nasal tip dropping. Previously, we used BZU2 thread, but nowadays you can move to EM25 or EM30. It depends on the length of patient, the length of columella of that patient. So for Koreans, shortly the Southeast Asian have very short nose. Sometimes we should elongate our nose with extension type thread, but with rest it's the opposite. You don't have to use this one. So you just want to correct the nasal tip dropping, you can insert EM type thread on columella. And the depression over the hump can be filled with the the multi-line thread. It has a volume. The 14 thread is loaded on one single cannula. And then I lift up the nasal tip and I also filled the depression over the hump with multi-line thread. Then I've already talked about the Cog Master Gear 1 and 4, the bidirectional cogged thread loaded on L-type cannula, WA-type cannula, bidirectional cogged thread, conventional one. But one more, the new model, Cog Master Gear Duo. Actually, even though it's PDO, it's Cog Master Gear, bidirectional. Actually, the proximal part is longer than the distal part. Cog Master Gear. The new type, Cog Master Gear Duo. Actually, we applied during the bidirectional cogged thread. As we pointed out, the center of the tissue will be contracted and protruded. It causes lumping, or it can cause some irregularity on the surface. To distribute this kind of irregularity evenly across the application, we can invent this type of zigzag type cogged thread. So before removing the cannula, you should pull up the tissue with your left skin. So it can be also loaded on WA type. So we've already talked about this reapplicatable application to correct the jaw. Additionally, I can insert Cog Master Gear Duo for the correction of jawline and lateral cheek hollow. You can make two inserting points on the tip of jaw, and there's a curvature like this, so you can make another point here. It must be about 4 centimeters apart from the previous one, and you can advance the cannula to the zygomatic cutaneous ligament. You can meet some resistance. Then if you penetrate it, the thread will go under superficial temporal fascia. That's the smooth layer on that area. If you try to insert the thread too superficially, the contour of the thread can be exposed on the surface. So you can insert the two threads here and here. For this time, it's a zigzag type thread. Even though you pull the thread anymore, it will not move. It's already fixed there. So before removing the cannula, you should pull up the skin with your left hand. And there's a lateral cheek hollow here. It's very difficult to correct the depression with the fillers because there are a lot of fibrotic tissues there. So instead, if we make two inserting points on zygomatic arch, and I can apply some zigzag type thread for the lifting of this tissue around here, it can partially correct the depression. So you can make a two inserting point on zygomatic arch and apply the zigzag type thread like the picture. On the medial side, the vector of depression is slightly different. On the medial side, upper medial to lower lateral. On the lateral side, upper lateral to lower medial. To correct this, you can also apply zigzag type thread. From the inserting point of a previous application, you can apply the thread from the inserting point to medial canthus and to lateral canthus. I do not use conventional bidirectional coated thread because the tissue around here will be protruded, so it will aggravate nasolabial fold. That's why I prefer to use zigzag type thread, duo. This is zigzag type thread. Apply after removing the cannula. Before removing the cannula, I pull up the skin with my left hand. This way, pull up. Even though I pull the thread will not move anymore. On zygomatic arch, I can also insert the 2 more threads. Slowly pulling up, pressing the skin with scissors, I can cut off the exposed part. I do not apply reinsertion technique for this zigzag type thread because it's already pulled there, already fixed there. The reinsertion type should be used for the thread of bidirectional type, not for fixing type. Okay. On the medial side, it's the same inserting point. I advanced 1 thread to the medial canthus, another to the lateral canthus. But there's an angular artery here. You should keep at least 1.5 centimeter from the canthus. The jawline became much better with these patients. Actually, she's Japanese patients. The correction of medial neck hooding, we can make 2 inserting points on midline, and we can usually use dual 4, which means the dual needle thread, which is 40 centimeters long. You can insert 1 needle here and advance it through subcutaneous layer. It comes out around here. You should be very, very careful not to penetrate parotid gland around here. Most of your patients do not have the big parotid gland in Middle East, but in Asian region, we have very protruded parotid gland. Sometimes it can cause some problem. So I usually apply 2 of them on midline. Additionally, better correction, we can insert the thread from mastoid area and advance it to almost the midline of the threads. So for this application, you should be very, very careful not to penetrate the parotid gland. Medial neck hooding was corrected properly for these patients. It can be also used to correct the upper arm drooping, belly, and the definition of hip. We usually use Kogomaster gear duo, the fixation type. So don't forget this message. This can be the take-home message. Do you remember these materials? PLACL, the 2nd generation thread materials, which goes about 4 times longer than PDO. It's not dyed, it's transparent. And do you remember the model of these products? Bidirectional coated thread, which is loaded on 10 cm long L-type cannula, WA type cannula, Kogomaster Gear 1 with L-type cannula, Gear 4 with WA type cannula. Zigzag type is called Kogomaster Gear Duo. What's this? Do you remember the name of this model? Extension type thread? Yes, Extend Master, EM. EM, Extender Master. It has 4 sizes, 25, 30, 40, 50. Furthermore, we can also memorize these 2 model dual and multi-line. Yes, I'm Plastic Surgeon. This is my Instagram and Facebook. Please follow me then I will follow you. Let's share good information on this SNS. This is the end of my presentation. Thank you very much.
Very interesting.